All right. Well, welcome everybody to our webinar this month. My name is Zach Mayo Fry. I'm the new Marketing and Community Outreach Project Manager here at the Miller Elder Law Firm, and we are
He's
so
also a
excited.
hundred other things, you guys. So if you ever are like, who should I call? And you can't figure it out, Zach is a unicorn.
I'll
Right.
get you to the right place for sure. Well, we are very excited to have an esteemed guest, Cheryl Harris, on with us today, and Shannon Miller, of course, the owner and founder of our law firm. I have a little bio for each of them to start us off because I think it's really important. They really know their stuff about this. So, just jumping right in, and like Shannon said a couple of minutes ago, if you have questions throughout, we're going to have question and answer time at the end to kind of bring. I know Cheryl has a lot of information through the slides, so you might have a question that she ends up answering a couple slides later. So we will jump into those questions at the end, but please make sure to put them in the Q&A. And then we will try to circle back to every one of them if we have time. And if not, we can also reach out afterwards. Okay, so Cheryl Harris is the liaison for SHINE, which stands for Serving Health Insurance Needs of Elders, with Elder Options in Alachua County, where she leads efforts to educate and empower seniors on Medicare, Medicaid, and long-term care coverage. With extensive experience providing one-on-one counseling and community outreach, Cheryl helps older adults and their caregivers navigate complex healthcare decisions with clarity and confidence. Her work through Shine has made her a trusted voice in Medicare education and a vital resource for seniors across North Central Florida. I will also give a little bio of Shannon because I know you all know her from the legal side, but I found out today that Shannon was in the Marine Corps, which is pretty amazing. And ChatGPT had to tell me that. But Shannon Miller is the founder of the Miller Elder Law Firm in Gainesville and a Florida Bar Board certified specialist in elder law. A nationally recognized advocate for seniors, Shannon brings deep expertise in Medicare, Medicaid, estate planning, and guardianship law. She is passionate about protecting older adults' independence and financial security while guiding families through the legal and policy changes that impact long term care. Through her practice and community leadership, Shannon continues to be a driving force in elder rights and healthcare advocacy across Florida and across the nation. So we're excited to have both of them. I'm going to stop talking and hand it over to their conversation and Cheryl's presentation.
And and I want to tell you guys, Medicare it's hard. It's hard and it changes all the time. And every time we do any kind of review, I learn so much. And you guys, we're in the trenches every day, those of us that are over 65, that you're trying to figure out, do we do Medicare? Do we use a supplement? You will often find that people are pushing Medicare Part C, which is a very challenging proposition for people. And I'm hoping I can press Cheryl a little bit on these Medicare Advantage plans, because frankly, over half the population of the United States is now in Medicare Advantage. And it always sounds good at the front end, and the broker who's selling it to you, and Cheryl probably can't say this, but I can, they get more money when they sell you a Medicare Advantage plan. And, sometimes it's okay. If you're in good health, it's great. But if you are, older and you suddenly have a healthcare event, you can get your Medicare back. You can get your traditional Medicare back. But the problem is your Medicare supplement. That once you switch to that Medicare Advantage plan, there's going to be an underwriter to get that Medicare supplement back. So if you have a Parkinson's diagnosis or dementia or something that's going to require expensive dollars, it can be very challenging to get that supplemental policy back. So I'm starting there, Cheryl. I know that you're not going to ever say that because you're an objective person, but I will tell you from our practice that we see a lot of people come in with Medicare Advantage plans, and sometimes the coverage is very challenging. And we're in an open enrollment period almost. So, if you have Medicare Advantage and there's an option for you maybe to go back to Medicare, traditional Medicare, and get a supplement because you don't have any health issues, I'm not saying you should. I'm just saying take a hard look. and see, are you then going to be eligible for that 100 days of Medicare in a rehab facility? If you go into the hospital for 72 hours and you really need that help for 100 days to get yourself back on your feet, where you're not cleaning your house, you're not making your meals, you're getting OT and PT and speech therapy and all these things that may be helpful to you after a huge health event, you need to look at your Medicare Advantage policy to see what it's going to cover those 100 days, and how financially challenging it can be. But then, remember that Medicare is really to help us get back on our feet. It's not long-term care coverage.
Right.
So it's really about rehabbing us back to getting onto our own feet. So take a hard look at your policies and let's listen carefully to what Cheryl's going to share with us today. Sorry to do that kind of intro, Cheryl, and put you on
No,
the spot,
that's
but
well, no, I appreciate the fact that Shannon, you are challenging us to be educated and informed and make decisions based on education and information, not on a hard press sell. Because you need to, my speech when I'm starting with someone is that everyone's situation's different. It's not a good idea to listen to someone who is necessarily selling it to you. It's not a good idea to listen to your neighbor or your cousin Susie in Pensacola or Pennsylvania. Everyone's circumstances are different, and you need to be an informed consumer and choose what is right for you. So all right, so I already had a question. Someone asked if I was an actual insurance agent, and I am not a licensed insurance agent. Great question. And so let me introduce you to the Florida Shine program and what it is that we do. We tell folks that we are your tax dollars at work. And so here we go. So, as previously said, I am with the Florida Shine program at Elder Options. This is a federally grant funded program that is offered in all 50 states and U.S. territories. In Florida, on the federal level, it's called SHIP, no, it is State Health Insurance Assistance Programs, but in Florida, the SHIP acronym was taken by another program. So in Florida, we're called SHINE, and it is our mission to provide free and unbiased health insurance counseling. We are so blessed here at Elder Options that we have a team of paid staff, but our larger core is with our volunteers. We are certified Medicare counselors, and we provide that counseling information and education so that people can make informed healthcare decisions. As I've already said, our services are free at the time of service. I'm always cautious about using the word free because we are your tax dollars. And but it's free at the time of service. It's unbiased and confidential information. When you come to counseling with us, your information, we do have to report to CMS as to who we helped, but we're not going to sell your information to others. If you call those 800 numbers that are listed with all the commercials that are out now with open enrollment, when you call those numbers, just the fact that you called, you are giving them permission to market you on everything that they sell. But we are not a part of that. Your information remains confidential with us. We do not sell, we don't endorse any insurance company or product. We are part of a network of the Area Agency on Aging throughout the state of Florida, and we are in that center section. We serve 16 counties, but if by chance you have a loved one outside of our 16 counties, we'll be glad to connect you with our sister agency throughout the state. So, Shine Counselors, my elevator speech is that we do all things Medicare. If it touches Medicare, we are here to help you out. So, I've had people say to me, well, I bet you're only busy during open enrollment. And the answer is we are busy throughout the whole year. And so people are turning 65 throughout the year. They're moving to Florida throughout December 7th. But people have insurance, Medicare issues throughout the year, like Medicare, something that was denied payment, then we can help you through that appeal process. And then a really big thing with Medicare is the fraud, and that's another issue. That's a whole other thing that we'll say for another day. But it's really sad that that is such a big deal. But today we're specifically talking about Medicare open enrollment. So those are for the folks who are already enrolled in Medicare, and this is the opportunity to make your changes for the coming years. So our open enrollment period for 2025, you are making selections for 2026. And people tell me all the time, my plan worked great this year. I don't need to come and review, but be an informed consumer. Never assume that your plan is going to work the same the following year. So Shine is here to help. And someone has asked if Shine is throughout the state of Florida, and the answer is yes. And then also this program is offered throughout the state, throughout the nation, and 50 states and U.S. territories. So back to our open enrollment period. By the end of September, you should have received a packet of information from the plan that you are currently enrolled in. So if you were enrolled in what we call a standalone prescription drug plan, you should have received a packet. And in that packet, it would have a side-by-side comparison that says this is what was covered in 2025, and these are the proposed changes for 2026. If you have an Advantage plan, if you're enrolled in an Advantage plan, same thing. And so it is important to look at those things and see what are the changes in my monthly premium, the deductible, copays, coinsurance. And we are seeing vitally important information on the formulary. So what is a formulary? Formulary is a list of medications that are covered by your plan. One must never assume that because all of my medications were covered under my prescription drug plan this year, that it's going to be covered the next year, because we are seeing some changes for 2026. And also we're seeing significant changes in the monthly premiums this year.
Cheryl, can I jump in for a second?
Absolutely, sure.
Okay, so we know there's Medicare Part A, Part B, Part C, Part D, and it goes on.
Right.
But you just talked about Part D as being the prescription drug plan. Can you kind of just walk us through the different 4 parts and what's covered under each? I think that sometimes it's very confusing for people, and if they have Medicare Advantage, they don't know, like, do I still need Part D? And so it would be helpful, I think, just to assume we
I've
don't.
got a slide for you.
Oh,
Okay.
excellent. Excellent.
All right, here we go back to our presentation. And I'll get to that one very quickly, Shannon.
Okay.
So now is the commercial season for open enrollment. Please choose wisely as to what you engage on those commercials and the calls that you make, and absolutely never be pressured into making changes, because that's when we do see folks with those pressure sales that they make their way into a plan that they truly didn't understand.
Right. And guys, they're going to tell you or give you money back. You can have dental and vision and all these great things. But when you actually do a cost analysis for that 100 days, that's where they get you. Because if your first 20 days are 100% covered, and then your 80 days in that long-term care bed are not covered, or I had a client recently who told me that really they were kicked out of their bed before the 20 days. So, I mean, you've got to know what's covered, and none of us think we're ever going to get sick, but the real cost hit is when you have to be in a rehabilitative bed for an extended period of time. And those beds can cost $500 a day. So, you're really talking about some serious expense if you have to pay that out of pocket. Okay.
Correct. So Shannon, here is our graphic that we use to explain the different pathways to receive your Medicare coverage. So original Medicare Part A and Part B, and just know that we do offer monthly classes that do a deep dive into this explanation. But I try to stay away from the words left and right. As a good gator, I try to refer to blue and orange. And so that way, I don't want to use the terminology of right and people think that I'm trying to indicate that it's correct. So I try to go with the terminology, the blue path and the orange path. And there's the or in between because what I tell folks, you can't drive on both sides of the street at the same time. So when you choose your Medicare coverage for the coming year, you're either receiving your benefits through original Medicare, which is federal health insurance, and then you supplement that with a Medigap, also known as Medicare Supplement, plus a standalone prescription drug plan. So when you have the four parts of original Medicare plus the supplemental type coverage here, then you are well rounded with your coverage here.
And if
Oh,
someone doesn't have that Medicare Part D, like I also talk to people who, they're turning 65 and they're like, I'm not on any medications. What is the downside to not getting that Part D when you turn 65?
so let's say they chose not to enroll in a prescription drug plan or that Part D when they were first eligible and then rock along to age 70 and now I have a medical diagnosis that requires medication. So you would be penalized for every month, not year, every month that you were eligible to enroll in prescription drug coverage but did not, times the number, the national average. So generally we say about $35. It was just quick math. So that $35 times 1% times the number of months that you were eligible and did not have credible coverage. So that's another screen, but I'll just go ahead and say now, if you have like VA coverage, with medications, or if you had it through a retiree plan, if you have it through an active employment through a spouse, that you would not face that penalty if you had credible coverage through another source. But if you were fully on Medicare and had no other type of credible coverage, that's when you would face that penalty for Part D prescription drug.
Right. So I want people to really understand that a little bit because I always get this question. Well, I didn't have a need at that point.
Mhm.
But if we run those numbers, so let's just say it's $35 a month. I just want to like run this number so people really understand it. $35 a month. And let's just say you didn't have coverage for the first 5 years. So we're going to multiply 35 times 12. That's 1 year. That gives us $420. And
But
then we multiply that by 5 years. And
And
that's
then times 1%. Okay, it's 1% per month. Okay, so you got to move your
okay.
decimal point over. Mm-hmm.
Oh, so I'm way over. Okay, because that's
Yep.
$2,100.
Yeah, $21. So okay,
Oh, it's $21. So then it
per
would be
month.
$21 per month.
Right.
Okay, so $21 per month times 60 months, if I'm running that.
Okay, wait a minute. That's going to be your penalty. It's going to be your $21. And so then that's per month on top of your prescription drug premium
On top of your prescription drug
for
premium.
as long as you are enrolled in prescription drug plan. I'm going to
So it
check the
would be an
math.
additional $21 per month in addition to maybe the $35
Mm-hmm.
that you would be paying per month. So in the end instead of paying $35 a month, you're going to be paying 35 plus 21.
I'm going to do the math real quick, but I just want to make sure that people understand we are so fortunate. There are two plans in our area that are zero monthly premium. So it is perfect for people. It's $0. There is no reason to not, and that's incorrect grammar, but there is not you should enroll in a zero premium plan. So you've got credible coverage through a Medicare prescription drug plan that's being offered. And also for people who have low cost generic medications. I mean, so there are other options. Never assume that there's not a good option for me.
Right. And if I enroll in a $0 plan and I don't have any prescriptions, then when I have that medical event 5 years later, and now I need to take regular prescriptions, I can shift to a different plan during open enrollment that then is going to cover that medication that I, have now been receiving without getting that penalty for not enrolling in that Part D when I turn 65. Okay. All right. She's
Right.
shaking her head. Yes. I know, Cheryl, like they won't see you on the screen unless you're talking.
Okay, I'm sorry. All right, so
Yeah.
we're in
But
speaker
they're probably
mode.
like, is she
Okay.
saying no, Shannon? No. She's shaking her head, yes.
Okay. So I did quick math. Yes, $21 per month is going to be the penalty. And that will be on top of the monthly premium. And that's for as long as you have prescription drug coverage. So
Yeah.
again, in the
75 are going to
past,
be paying that $21 premium. And it might be more money the longer you wait, right? Then it could cost more because the average is going to be higher.
right.
Okay.
Yes.
Yeah.
Okay, so I think maybe we cleared that up, and someone said that that's not fair. I understand, but this is better than when I first started with Shine over 10 years ago. There was not a zero premium plan. So at least we have a few more options now. So you can't buy your way out of the penalty. So you need to, and these are the rules today. Now that's not to say the rules won't change in the future, but these are the rules today.
Yeah, and one of our attendees just said she paid, her husband canceled his Part D at one point and didn't tell her, and he had to pay 38 a month in penalty.
Hmm.
So guys, especially if there's a $0 Part D premium that you can get, so you can always shift during open enrollment to a different plan, and then you're still enrolled, but you're not paying anything, and then you won't get that penalty. So this is like a brilliant Cheryl Harris tip. Got to get a plan, even if it's $0. Like this is a no-brainer. There's no downside to it. So
Right.
let's take that with us.
And
Okay.
I hear people say, I don't take medicine. I'm never going to take medicine. And I just tell
What?
them, folks, that is not a good plan. Okay. Because sometimes life happens at the
I
least
know.
expected moment. So
I know. And
that's what,
everyone's gonna die in their sleep, and they're never gonna get sick, and they're never gonna lead to long-term care, and you're never gonna go to a nursing home. And yes, unfortunately, the statistics tell us otherwise.
correct.
So yeah.
Yes. All right. So we were talking about back to our little chart here. So we've got the blue pathway and the big or in the middle. So remember, blue pathway starts out A and B with federal health insurance. Other pathway are orange pathway, Medicare Advantage. Sometimes you'll hear it referred to as Part C. Sometimes you'll hear the commercials say Medicare health plans. They're using different, word salad, but they're all talking about the same thing. It is Medicare Advantage or Part C. And this is offered by private insurance companies. So the federal government is paying these private insurance companies a monthly capitated rate for every person who enrolls in their plans. So if I was enrolled in Medicare Advantage Plan A and Shannon was enrolled in Medicare Advantage this Plan C, and then Zachary was in, I'll say, Plan green, just whatever, 3 different ones. So on average, the federal government would pay each one of these plans $1,000 a month to manage our health. and manage. So you are giving the insurance companies the ability to drive the bus for your healthcare decisions because they are managing what is available to you. Okay, so someone just
And let
said,
me let
mhm,
me like kind of slow that down a little bit.
sure.
Okay. So everybody really understands that. And I think there can be some questions about this. But what that means is to get people off of traditional Medicare, the government is paying these insurance companies $1,000 a month to take you off of that Medicare unknown amount of money. So this insurance company now has $1,000 to cover all your medical needs. So
Per
what are
month.
they going to do? And Cheryl's never going to say this, but I will say it. They're going to try not to pay the money out for coverage. They're going to say, we have this process for coverage. You need to go to your primary to get the referral to a specialist. You have to get this surgery that feels emergent pre-approved. And the pre-approval process is so challenging that sometimes it can mean that you don't get the surgery because you're waiting for that approval process. Meanwhile, you're getting sicker. And so like it's really, you want to think about the business model of Medicare Advantage plans. It's not to benefit you because they're making a ton of money. They are making money. So they get $1,000 a month per person. Their job is to try and keep as much of that money as possible because that's profit. That's not the way traditional Medicare works. Traditional Medicare, when you have a surgery or when you're referred to a specialist, that is already approved. You don't have to get it approved by the insurance company. So, have I said that right, Cheryl? Have I missed
Well,
it?
it is a fee for service. So they, when you have a service, the doctor or the hospital facility, long-term care, whatever, they are billing. They receive a fee for the service that they provided. And you are absolutely correct that most doctors are in healthcare facilities. They know the Medicare process. They know what codes are going to be used. Now, that's not to say that sometimes it's a bumpy road, but that's where Shine can help with that appeals process. But those are the the path of least resistance is going to be with original Medicare and that fee for service model. Whereas, as you said, Shannon, with those Medicare Advantage, private insurance companies, you have to keep in mind they're in business
Right.
to make money. I mean, but that's not to say that they're bad because they
Yeah.
offer other types of benefits, but you have to determine are the benefits that they offer in the long term, is that in my financial best interest? And that's where you have to weigh out the pros and cons to both pathways.
And I think the other thing that you need to know as a consumer is that a lot of like facilities or a lot of physicians or a lot of practices will ask you for your insurance and they won't always accept that Medicare Advantage coverage. And some of them have negotiated with the Medicare Advantage, yeah, we'll take it or we won't take it. And so, you want to find out ahead of that scheduled appointment if
Mhm.
in fact your advantage plan is gonna be accepted at that particular place that you're getting services.
Well, and another thing people need to keep in mind with Medicare Advantage is that it is a fluid situation. My doctor may be in network as I'm looking for 2026, and then either the provider or the plan may choose the provider may choose to no longer participate with the plan, or the plan may say, we've got too many doctors in Gainesville and we're going to get rid of some of these doctors. And then you get this letter from your healthcare provider that says we're no longer in network with this plan. So if you want the largest network of providers throughout the United States, then that is going to be Original Medicare. You want to get this supplement to cover those additional costs and a prescription drug plan so you don't have additional penalties or anything down the road. But that Original Medicare is going to be your largest nationwide of providers. It's going to cost more. But you're paying for flexibility. You're paying for that rehab up to your, depending on the supplement you choose. You could have that 100 days of rehab. You can have that additional home health care after you do go home. That is going to be your greatest amount of flexibility.
And when you go to that broker, so I know someone in the chat was like, I need somebody in Orlando and da da da. They're going to want to sell you the Medicare Advantage because they make more money as a broker by selling you Medicare Advantage than they do traditional Medicare. So, you know, they have an interest in getting you into that Medicare Advantage fund. I was talking to a broker last week who was telling me, I was like, how many people did you enroll in Medicare Advantage versus how many people did you enroll in traditional Medicare? And he's like, well, we enrolled, you know, most of them were in Medicare Advantage, but we also offer them this insurance, this whole life insurance product. And I'm like, that's going to disqualify them from Medicaid. Like, that's not going to bridge the gap. So, you know, they're getting creative with how to spin it. But in the end, the question is, what are you going to pay more for? Are you going to pay more to the federal government, you know, for traditional Medicare? Initially, you are. And if you stay healthy until you die, you may have paid more for traditional Medicare. But if you're like 98% of the population that's going to spend a lot of money before you die, then it's probably in your best interest to stick with traditional Medicare. And the other thing that I will say is, and this is a really hard question, Cheryl, and I know you're going to probably be like, oh, Shannon, you're on the Medicare Advantage plan, right? And you do have that health event. You realize that it doesn't cover you. When we're not in open enrollment, what is the process for switching from the Medicare Advantage plan back to traditional Medicare? Is there a process? Are there any circumstances where that can happen outside the open enrollment period?
Yes, so a couple of options. If we see this a lot whenever people leave their 3 night stay at the hospital and they go to a skilled nursing facility for rehab. And traditionally, many of the skilled rehab facilities in our area, they want people to switch back to original Medicare. And when you have that change of address, that can, and you are not official change of address, but you have changed your residency for that period of time to the nursing home, skilled rehab, that does trigger a special enrollment. But we just caution people that when you do that, you're going to be exposed to the additional cost of what original Medicare does not cover. So you just, it sounds great and it's really good for the rehab facility to get people to switch because they're going to be able to offer a longer stay, they're going to have additional services. But if there are additional, like you have to be rehospitalized, if you faced any type of surgery, you're going to be on the hook for those additional costs during that
Yeah,
time.
yeah, and let's break that down a little bit. So what we're talking about is, you know, you kind of enroll when you're 65, you get that part A and part B, right? And then as you remember that chart, it's talking about that Medigap or supplemental insurance policy, which when you enroll, and correct me if I'm wrong about this, Cheryl, but there's no underwriter when you turn 65 and you get that supplemental insurance. Like, you just get it. You apply for it. They can't ask you questions about your medical condition. So she's shaking her head yes.
Yes, I'm sorry. I was trying not to interrupt you, but yes, I can talk about guarantee issue. Okay.
Yes. But when you're on that Medicare Advantage plan and you have that hospital stay, now you're moved into that rehab bed and the business office is coming to you saying, we're going to move you off Medicare Advantage because they're only going to cover 7 days of your stay. If we move you back to Medicare, traditional Medicare or original Medicare, then you're going to get this 20 days, 100% coverage, right? So lovely that's going to happen, but what happens with the rest of your stay? So if you're going to stay that first 20 days and it's 100% coverage, great. But the rest of your stay, 80 days at $500 a day, you can imagine the cost of that. It's going to hit hard. So you just say, oh, well, I'll just get a supplemental insurance policy. They offered one before to me when I was 65, but I didn't have to do and go through any medical exam. But now you do. Now you do have to go through the medical exam for underwriting. So that supplemental policy, you can probably still get it, but it's going to cost a mint because you've just had a major health issue. So the business office at the facility is going to really want you back on traditional Medicare, but that supplemental policy may be unavailable to you or unavailable at a price you can afford. You're not going to get it for the same price that you got it for when they couldn't ask you about your medical condition on enrollment. Am I getting that
So,
right?
yes, absolutely, you are getting that right. But one thing I want to say is that more than likely they will not write you a policy. If they're going to ask, have you been hospitalized? I've seen some of the questionnaires say 6 months, some say a year. And so people think, well, I'll just pay more. Well, you can't, again, you can't buy your way out of this. They are
Yeah,
going to flat out refuse. And
that's good.
when you are beyond that guarantee issue, so for in Florida, guarantee issue is when you have both A and B, Medicare Parts A and B. And when you are enrolled in both, your clock is now ticking. You have 6 months for guarantee issue that they cannot ask you any medical questions. You don't have to go through a health questionnaire, all of those types of things they cannot ask you. And so that's your window of opportunity, and that is going to be your least cost at that point. And when you purchase that, suppose I purchased it at 65, or if I purchased it at 67, if I delayed my Medicare enrollment due to employment, there are criteria in Florida as to what those rates are based on. And here again, you come to Shine and we'll walk you through that whole process. We'll show you how to discover those rates.
Yeah, and I just want to just hit on it one more time because how important it is. Because this inability for the insurance company to ask you about your pre-existing conditions, right? So this 6 month period is like a gift
Yes,
because when that 6 months is gone, they can ask you anything they want. And they can
yes.
even get your medical records and they can do a medical exam. They can come out and take your blood and your blood. So, like, it is a gift. So, when you're thinking at 75 years old, I haven't had a lot of health issues, I'm very healthy, I have low blood pressure, and you move to that Medicare Advantage plan, like over 50% of the United States has, again, when you need to go back, it just isn't available to you because that 6 month window of not asking you about your pre-existing conditions is gone. So, that's the real risk, in my opinion. That's the stuff that I see every day for clients is, unfortunately, that getting that supplemental policy again is really challenging. And people are like, well, it was so expensive to begin with. Like, and I'm like, yeah, just wait till you get a bill from a rehab, bed for just a couple weeks. It can be shocking. So
Well, and also, I've had a friend from the small community where I live, and she said, my retiree plan is getting so expensive. She stayed with the retiree plan. And so she's like, I think I'm going to switch to and purchase a Medigap policy and get a prescription drug plan. And she could do that during open enrollment for prescription drug. Now, you can switch any time of the year to purchase a Medigap supplement, but you've got to watch for those pre-existing conditions. And she said, there's nothing, I don't take any meds, I'm in great shape, blah, blah, blah. But when she went through the questionnaire, I mean, they literally start at the top of your head and they work their way down with every system in your body. And when they got to her eyes right away, they asked about eye condition. And she said, well, yeah, I was diagnosed with blah, 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 but I don't take any medicine. There's nothing they can do. And they stopped the questionnaire right there because she had this benign type condition that that and she had no idea that they would turn her down just for that. So we had to be.
Cheryl, let me ask you this too, because with those retiree programs, so
Mhm.
I've also seen where if we have someone who is retired and their employer put them in a Medicare Advantage plan. So that's another problem, correct? Is that sometimes your retirement program is in fact a Medicare Part C or a Medicare Advantage plan. Is that still happening?
And we're seeing more and more of that because again the retiree benefits have gotten so expensive for companies, but those are not the Medicare Advantage plan that we can view on the Medicare Plan Finder on Medicare.gov. These are special negotiated Advantage plans. So we always caution people when you go and say, well, I have an Advantage plan. You have to be very specific when you tell your healthcare provider, I have a retiree negotiated Medicare Advantage plan. So it's not the traditional type Advantage plan that you see being advertised on the television. And you need to work closely with your benefits manager to find out exactly how that's going to coordinate when you go to the doctor. That is a whole separate ball of wax.
So Cheryl, look, the no-brainer every year is to make a Shine appointment. It's free.
Absolutely. Absolutely.
Bring in the packet that they sent you in the mail by September 30th, and you bring in your medication list and what issues have developed for you, if you have a new diagnosis or something like that from your medical doctor, and you sit down and look at the options. I mean, that's pretty much what's going to happen during that Shine meeting.
Yes, so you bring that complete medication list. Don't say I'm on a torvastatin. No, a torvastatin, 20 milligrams one time per day. So we need that complete medication, and those are prescribed medications, not over the counter. And then if you specifically are looking for Advantage, you want to bring your list of providers so that we can do a little research. And then you need to do your research as well. Find out what plans that your healthcare providers are in network with. And then when you're going to bring your current cards, you're going to bring your Medicare red, white, and blue card. And then if you have a Medicare.gov online account, bring in your login credentials. It goes a lot faster for us if you bring those login credentials with you. And so we can get into your account quickly. We can update your medication list, and the search goes much quicker.
How
And
long,
Shannon,
how long do those meetings last, Cheryl, typically?
it depends on the complexity of the medication list. If someone already has their Medicare.gov account and we can quickly get in there, it's going to go a lot faster than because we can already see what current coverage someone has. There's a lot of things that we can see in there, and we encourage everyone to, and the government is really, they're really coming down to almost making people have their Medicare.gov account, which, Shannon, in your business, I would encourage people to do that. And then for your adult children, and absolutely everyone on Medicare should, in that account, you can designate a representative who can speak on your behalf. Now, as
Yeah.
Medicare counselors, we have a backdoor number with Medicare, so we can cut through the queue, the wait list. We can talk to Medicare right away. But if you are incapacitated and cannot speak for yourself, you need at a minimum to have one person listed on your account as your representative, and you can manage all of that through the Medicare.gov account.
And even if you're not incapacitated, because one of our questions was about the husband doing things without
Yes.
the wife knowing, or
Yes.
the husband doing something without the husband knowing.
Yeah.
So, okay, but one question for you on that.
Sure.
Um, okay, let's say we're outside open enrollment,
Okay.
okay, and you get a new prescription from or a new diagnosis. Can they then ask for a Shine appointment to say, like, okay, this has come in. Should I now try to make a special, you called it like a
Special enrollment period.
situation, right? Or a special
Well,
or
yeah,
something.
special enrollment period for when you were in a facility.
Right.
Unfortunately, for standalone prescription drug plans, or if you have a Medicare Advantage plan that has prescription drug coverage with it, getting a new medication does not trigger a special enrollment period. As well as we had a lot of folks who in the Gainesville area who got letters from their Medicare Advantage plan that says my doctor is no longer in network with your
Yeah.
plan as of September 1. Well, you can't do anything on September 1. So you, but especially when when it comes to medications, we can help research to see if people aren't familiar with GoodRx or other type programs. There are other websites that we can go to research, are there patient assistance programs for the ones that are incredibly expensive, excuse me.
Yeah.
So there are other things, but specifically during open enrollment, that's in, we encourage people, don't wait until December 1st, or it runs, it's October 1st, 15th through December 7th. And if, like for instance, in Alachua County, we're at the Senior Rec Center from 8:30 to 11:30 on Tuesdays. And don't come at 11:15. That's just not enough time. And the rec center, they're very gracious. They've given us more space than we previously had, but those are not scheduled appointments. These are walk-in sites here in Alachua County, but in all 16 counties that we serve, we have counseling locations.
Yeah. So, after your bingo, maybe you go late to bingo one day, or you go to your yoga class, then you go to, like, people are at the senior center. You're doing your, tennis, or, whatever you got going at the senior center. Just remember, on Tuesdays, 8:30 to 11:30, you can go in and really get your stuff reviewed. And I think it's so important because I think you're right. People don't really look at that update for the next year, and they might just think, like, oh, this was great insurance this year. Everything's going to be the same, but they're not really scrutinizing, what could happen. So what does constitute a special circumstance where there would be an open enroll, not a special enrollment period? We talked about a change of address. Is there anything else that might trigger that special enrollment period?
So, talking specifically about special enrollment periods of change of address. So, I had a couple who lived in the villages in Sumter County, and there are specific, with Advantage plans, not only do they differ state by state, but they differ county by county. So there was a plan specifically for Sumter County that was offered in the villages, and it actually had the villages in the name of that plan. So they moved from Sumter to Suwannee County. They moved to Advent
Ooh.
Christian Village, ACV at Dowling Park. So when they moved up there, that plan was not offered in Suwannee County. So that triggered a special enrollment period for them. And it also triggered for them guarantee issue to purchase a Medigap policy because the plan they were enrolled in was not offered in the county of which they moved. We also saw here in Alachua County, and I think around Levy and maybe in Marion, there were two plans that were completely dropped by the the insurance carriers. I won't call those names, but those folks got those letters that said because your plan is being totally discontinued, you now have guarantee issue to purchase a Medigap policy. So that's the golden ticket.
Right.
And we found folks that didn't open that mail until way after the first of the year. And that's you need to open the mail. You need to look at it. You need to read it. If you don't understand it and it's related to Medicare, bring that to a counseling appointment with us.
Yeah, and I think that, you're calling it a Medigap policy. I know the last time we met, it was like, Shannon, it's Medigap. So for some people, they still call them supplemental policies. So it's a Medigap policy is really the name of it. And like Cheryl said, that's the policy that you get that 6 months of they can't ask you about pre-existing. So if they're giving you this Medigap or supplemental policy, I'm assuming, Cheryl, that also means there's not going to be any examination or discussion
Correct.
about your pre-existing condition.
Right.
There,
That's your golden ticket.
yeah, golden ticket.
Mhm.
Okay, I love that. All right, so I want to just go back on your example of them moving from the Villages to Suwannee County to that really cool place. I love that place. It's at the
Mhm.
Advent Health place. It's really awesome.
Yes.
But you said that they didn't offer the same policy there. Is that a requirement, or is it just that
That
they
is,
changed address as that?
no,
No, there has to be
no,
an
yeah, for
absolute
them to have
policy.
that guarantee issue, they, in that special enrollment, they have to move to a county that their plan was not offered.
Okay. But I mean, even if they offered that plan, if the terms of that plan were terrible in the new county that they moved to, there's only one doctor you can go to, you're
That
stuck.
does not, you're stuck.
Okay. Okay. All right. That's a lot. That's very clarifying, because I think that's the question that a lot of people have is like, oh, I love my Medicare Advantage plan. I'll just move to this new place and use the same plan, but it might not be the same plan in that other place where you are. And
Correct.
that hospital may have a different situation with that particular plan. So,
Right. I
okay.
want to back up and I know we have dumped a lot of information
Yeah.
today, but and I know we're running out of time, but Shannon, I also want to revisit that if someone, and I'm going to be on your train this time, and the fact that if someone is wanting to seek a higher level, and I'm not saying that what we have offered in Gainesville is not higher level, but if they are wanting to go to Mayo Clinic, MD Anderson, Moffitt, any of
Yeah.
those places, if you are wanting that wider array of coverage, then you're looking at original Medicare with a Medicare supplement, or known as Medigap, and your prescription drug. That's going to round you out. That's not to say that there can't be exceptions with Medicare Advantage, but those are going to be more limiting, but that's not to say that they're bad. It's just it's going to be more limiting as to what your options are.
Yeah, and I'll tell a personal story. My mom had pancreatic cancer, and
Mm.
she was in like a PPO. So she was just 62. She didn't even have Medicare at that point. And she had pancreatic cancer, but she didn't get a diagnosis for like 2 months after she was referred, because she had to wait in order to get that appointment. And then, we went to Johns Hopkins for this special MRI that they did to do that diagnosis, but it took another couple of months to get that pre-approval, which, I mean, does that mean that we would have been able to treat it? Maybe, if we'd had an earlier diagnosis for that, it may have changed everything. So, I mean, but the reality is your insurance matters, and the
Absolutely.
delay can really have a huge impact on especially cancer diagnoses. If you can get the Whipple surgery where they cut your pancreas out, you can live, a life without a pancreas, but not if it's moved on to your, liver and your lymph nodes, and it's in your brain and your bones. So health insurance is important, and, pre-existing conditions can create a definite disadvantage for people who need to purchase supplemental policy and don't have the golden ticket. I'm going to start using that golden ticket, Cheryl. I love that.
Most would get that reference.
Love
Anyway.
it. I love it. And now Zach knows it too, and all our participants out there. But we sure appreciate you coming on. Is there any more questions? Anything else? Zach, you are, you've kind of been listening in on this. Are you like totally, this is a lot. It's very complicated. It's like you need a degree in Medicare. Is there
Yeah.
anything that you've heard that you're like, wait, I still don't really understand something, or anybody from the audience, because we've got a couple more minutes left.
From my perspective, I'm coming into this with no knowledge of Medicare, and this was extremely helpful being
Oh,
at the
good.
firm and understanding the two different routes and the not
Yeah.
left and right.
Yeah, I
The
love
orange and
that.
blue. Yeah.
I've never seen it explained like that, Cheryl, with the two pathways. It's like you either have this or this. You don't have both, and they
Right,
don't, they don't cross each other. But
right.
yeah, it's, and I think more and more people will continue to get Medicare Advantage plans, despite kind of the sky is falling pushback from a number of people. It's just the financial incentives to sell the product are so, huge that it
Hmm.
makes for a very challenging process for us to say, like, make sure it's good for you, when you have a trusted insurance agent telling you that, this is going to be fine because you have no health issues, it's hard.
Right.
So, anyway.
Well, I've just put in a plug. If you are in our region and you're wanting to contact the Shine program, that's 1-800-262-2243. That goes to the Elder Helpline. If you want our direct line, that's 352-692-5209. So anyway, you can always go to floridashine.org and find our contact information as well.
Thank you, of course, for all the work that you do, and the patience. I don't know if you guys have ever dealt with the volunteers at Shine, but they are so incredibly patient because people don't know anything, and they kind of
Mhm.
come in with this stack of papers, and somehow the Shine volunteers like work through everything, and at the end of your appointment you have a somewhat of an answer, or at least some options. So I just love what you guys do. Thank you for doing it. And yeah, thanks for coming back. And I'm sure we're gonna
Thank
have you
you.
back again if you'll come, because it's always just so informative. So I learned
Well,
something every single time. Thank you.
well, thank you. I hope your audience found it informative.
Yes, it's quite an
Absolutely.
audience that we have. It's the best and brightest, so I'm pretty sure they're dialed in. But anyway. All right.
All
Thanks
right.
so much, Cheryl. I hope you have a
Thank
great
you.
open enrollment. I hope it's not overwhelming for you. I'm just like tax season for CPAs.
Right. All right.
Awesome. And if I
Yeah,
can
Thank you.
put
all the
I could
best.
put a little plug in to wrap us up. Our next webinar will be on November 5th, and we will be talking with the Director of Elder Care at the Senior Center, Jeff Lee, and Nicholas Hauser and Stephen Hulsman. So super excited to get them on here to talk about what Elder Care and the Senior Center does here in Gainesville.
Yeah, and you guys, if you don't know, then you need to go check it out, because the senior center is like, it has a vibe. And the vibe is amazing. I mean, I was just over there doing some bingo stuff the other day, and like the yoga room had 70 people in it. Like it's buzzing. There is always something to do at the senior center, and yeah, it's really a lot of fun. So we'll hear all this good stuff about what's happening at our next webinar.
Awesome.
Okay.
All
Thank
right.
you so much, Cheryl. We know you
Thank
just came back
you.
from vacation and jumped
Yep.
right in here to do this with us. So we are super appreciative. And
Well,
we'll see
thank
everybody
you.
next time.
Thanks
Thanks
so
very
much.
much. Bye-bye.